Insulin is a hormone produced by the pancreas. It helps metabolize blood sugars, which are the body's main source of energy. Diabetics either don't produce enough insulin or their body doesn't utilize insulin effectively, resulting in out-of-control blood sugars. Diabetics often keep their blood sugar levels in check by taking insulin directly or by taking a medication that increases their insulin production. Sounds simple. Have high blood sugars? Easy. Take a bunch of insulin. That'll take care of it. It's actually a delicate balance. Having too much insulin can cause problems too.
If you're taking medication which stimulates the production of insulin, or you're actually taking insulin injections, either way, your body will respond to that by digesting the foods that you're eating. You break down the fats and the protein and the sugars that are in your intestinal tract. But if you've produced more insulin than you've eaten, or you've given yourself more insulin than you're covering when you eat, that will cause the blood sugars to drop. And that's when you become hypoglycemic.
Symptoms of hypoglycemia, or low blood sugar, are lightheadedness, shakiness or dizziness, sleepiness and fatigue, anxiety, anger and irritability, sweating, chills and clamminess, confusion or an inability to concentrate, lack of coordination, tingling or numbness in the lips or tongue, even seizures or unconsciousness. Not all of those symptoms occur at once, and everyone reacts to hypoglycemia in different ways. It's important for diabetics to recognize the way their body reacts so that they can correct hypoglycemia as soon as possible.
And if that's happening, we tell our diabetic patients, as soon as you feel something like that, check your blood sugar. Do a finger stick on it and see where you are, and if that's what's happening, you give yourself some sugar. If you feel that way and you check your blood sugar and it's not, then there's something else going on, and that maybe requires you to go to an emergency room or something like that.
If the blood sugar levels are low, the patient should consume 15 to 20 grams of glucose or simple carbohydrates. After 15 minutes, he should recheck his blood sugar levels. Repeat this cycle of eating and checking until the sugar levels are normal.
The easiest thing is there are some sugar tablets out there on the market that you can get in the drugstore. And typically you just chew 2 to 3 sugar tablets, and that's all you need. So you can carry it in your pocket, you can keep it at your bedside, you can do all of that. The other thing is if you're home, then it's not unreasonable to take some orange juice, maybe put a couple of teaspoons of sugar in it, and that'll raise it up as well. So those are the major ways of going about treating hypoglycemia.
Hypoglycemia usually occurs when the blood sugar levels fall below 70 milligrams per deciliter. However, this isn't a set number for everyone. Many people fall below this level and feel no symptoms, which can be dangerous.
And you want a fasting blood sugar, let's say between 70 and 110. But if you've got an elderly patient, somebody in their 70s, 80s, and they run blood sugars of 80 or 90, they may not realize it when those sugars start going even lower. And we see that happen. And hypoglycemia in an elderly individual can be a very serious problem. It can lead to strokes, it could lead to heart attacks, it could lead to death. So it may not be reasonable to treat an older patient the same way that you treat a younger patient.
If someone suffers 1 or 2 episodes of hypoglycemia over the course of a couple of months, they need to contact their doctor. A simple change in medications may be able to prevent a future episode. Practicing good blood sugar control can help prevent hypoglycemia as well. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.